Hi, and welcome to Global Undiagnosed Day
2026.
We are from Wilhelm Foundation, Helene Cederoth.
Nick Cederoth.
And we are very happy that you will join us today and share what's happening in
this space in the world. Yes?
Yes.
We will start off with our keynote speaker.
It's Maja, sorry if I pronounce your name wrong, Bortosiewicz from Poland, and then Hanna Havryushenko from Ukraine.
So here comes our speakers.
My name is Maja Bartoszewicz-Moritz. I'm a patient council rare disease center at the Medical University of Gdańsk coordinator. I'm speaking from Poland as a mother, patient advocate, and someone who spent nearly 9 years in the world of the undiagnosed. For almost 9 years, my daughter and our family fought for answers. 9 years of medical appointments, 9 years of tests, 9 years of hearing we don't know. Let's wait, seek another specialist. And during that time, life do not pause. Children continue developing, symptoms continue progressing, families continue carrying enormous emotional, physical, and financial burdens. For us, those years meant losing precious time. Time for early interventions, for care planning, time that could have changed certain outcomes. It also meant financial losses, traveling between specialists, paying for consultations, therapies, ongoing line. It meant professional sacrifices, and it meant emotional isolation, because when your child does not have a diagnosis, people do not understand quite often what are you going through. You live in uncertainty. You don't know what tomorrow's gonna look like. You live in fear. You don't know if the condition might worsen. You don't know whether the treatment exists. You don't even know where to look for help. And this is why Global Undiagnosed Day matters. Because behind every undiagnosed case is a family waiting for direction. Today we often speak about technology, and rightly so. Genomics, artificial intelligence, data sharing, advanced diagnostics. The innovations are critical. But technology alone is not enough. Education is equally important. We need clinicians who recognize rare disease symptoms earlier. We need healthcare system that knows where to refer patients. We need professionals trained to interpret genetic data. We need families to be informed and empowered. And we need policymakers to understand the faster diagnosis changes lives. Because diagnosis is not the finish line. And it's not a miracle that suddenly solves everything. Diagnosis is a pit stop. Changes trajectory, a roadmap. It connects patients and communities. Open access to specialists. It helps families find appropriate care and support system. And it creates opportunities to participate in natural history data studies and future clinical trials. And most importantly, it gives hope. After nearly 9 years, we finally received my daughter's diagnosis. And even though our challenges did not disappear, but for the first time, we knew where we are going. We found community, We found research opportunities. We found people who understood our journey, and we found hope. Today I work across advocacy, research, and international collaboration because I do not want other families to lose nearly a decade searching for answers. This is why gatherings like Global Undiagnosed Day matter. This is why collaboration between families, clinicians, researchers, and policymakers matters. And this is why every person working to shorten the diagnostic odyssey is changing lives. To families still searching, please keep going. To everyone who's working to make diagnosis faster, fairer, and more accessible, thank you. Because diagnosis is not the end of the journey. For many families, it is the beginning of a new one.
Hello, my name is Hanna Gavryushenko and I live and work in Rivne, a regional center in the northwestern part of Ukraine. I work as a clinical geneticist at Rivne Regional Medical Genetics Center, Regional Center for Rare Diseases, Radiation and Specialized Medicine, and also at Epidoc Clinic. Today, on April 29th, I would like to thank Wilhelm Foundation and Erdera for creating a space for medical specialists, researchers, and families to come together, reflect, and ultimately make a meaningful change for 350 million of people worldwide living with an undiagnosed disease. Thank you, Helen and Mix, especially for inviting people from underrepresented countries, such as myself, to share our perspectives. It means so much to be heard. So, in Ukraine, too many families have to deal with uncertainty of not having a definitive diagnosis for their loved ones. Not always because the disorder is unknown, but also because of inaccessibility of comprehensive genomic testing to a vast majority of population, due to high costs, systemic constraints, and challenging and often dangerous conditions we're working under. But today, I would like to share with you how things are changing for the better. In October 2022, Ukraine has implemented an expanded neonatal screening program for 21 rare disorders. This is a colossal effort and a remarkable accomplishment for any country, but especially for one defending itself from relentless aggression. Secondly, Ukrainian patient organizations and disability advocates are doing tremendous work, volunteering, crowdfunding, working closely with clinicians and regulatory institutions, truly embodying the principle, nothing about us without us. And of course, we're building international collaborations. Crucial initiatives, such as creating the Rare Diseases Hub in conjunction with UDNI and integrating Ukraine into the ERN workflows, are coordinated by Ahmedit Children's Hospital in Kyiv. Meaningful clinical and research projects are led in other regional centers as well, Lviv, Khmelnytsky, Uzhhorod, to name a few. As for our own work, for many years, Rivne Medical Genetics Center has participated in international research consortia, working on fetal alcohol spectrum disorders, congenital malformation surveillance and prevention, and long-term effects of Chernobyl on population health. In the recent years, we have been fostering meaningful connections with several European research groups, giving access to comprehensive genomic testing to our most vulnerable families who otherwise could not afford it. Right now, we're working on incorporating our center into other initiatives for underrepresented countries, such as Erdera, Diagnostic Research Workflow, and I Hope Genetic Alliance. A saying goes, it takes a village to raise a child. But for people living with undiagnosed diseases, it often takes a global effort to find answers. No single clinician, institution, or country can do this alone. So let's be each other's village, for every patient and every family still searching, regardless of geography. Once again, thank you Erdera and Wilhelm Foundation. Thank you Helen and Mig for inviting me. Most of all, I'm thankful to our defenders. I'm only able to record this message because of their unwavering courage and determination.
Thank you, Maya, for your story. We are so thankful that you're talking about how it was to have an undiagnosed child and what's happening when you got the diagnosis. And also thank you, Hanna, for telling us how it is in Ukraine. And we are with you both. And when you have an undiagnosed child or are undiagnosed by yourself, you are left behind. And we think that it's so important on Undiagnosed Day to show that we are with you and the whole community who are working with the undiagnosed diseases. Since the other days you feel like you're left behind from the healthcare, from the society and from the community. But we are many who works to hope to solve the undiagnosed diseases.
For millions of people living with undiagnosed diseases worldwide, receiving a diagnosis is the first step toward treatment, support, and dignity. Yet many patients remain without answers even after years of medical visits and tests. This problem is especially serious in low and middle-income countries, where healthcare systems often face limited resources, few specialists, and reduced access to advanced genetic technologies. For families, the lack of a diagnosis can mean uncertainty, repeated hospital visits, ineffective treatments, and heavy emotional and financial stress. This long and suffering process is known as the diagnostic odyssey. It can last many years and often includes misdiagnoses, delayed care, and emotional strain for patients and relatives. In rural or underserved areas, the burden is even greater because hospitals may be far away and repeated consultations too expensive. As a result, many patients move from one clinic to another without receiving clear answers. One major difficulty is that many rare conditions have symptoms that are vague, variable, or similar to more common illnesses. This makes diagnosis extremely challenging. Limited access to tools such as advanced genomic tests, together with a shortage of specialized expertise, can delay or prevent accurate identification. Even the best genetic tests currently provide answers for only about 40% of patients, leaving many still searching for a diagnosis for years or even a lifetime. Without a recognized condition, patients may struggle to receive proper care, social support, or acknowledgement of their suffering. Undiagnosed diseases are not only a medical issue, but also a social and economic one. Children may miss school, adults may lose the ability to work, and families may fall into poverty while seeking care. At the same time, healthcare systems lose opportunities to collect data, improve prevention, and develop better treatments. This is where the Undiagnosed Diseases Network International, or UDNI, plays an important role. Founded in 2014, UDNI is a global collaboration of clinicians, researchers, patient representatives, and institutions working together to solve complex, undiagnosed cases. Its mission is to connect expertise across countries, share knowledge, improve diagnostic methods, and bring hope to patients. A major strength of UDNI is its multidisciplinary approach. Complex cases are reviewed by specialists from different fields, increasing the chance of finding the cause. By linking expert centers worldwide, the network enables the exchange of data, knowledge, and advanced technologies. UDNI also contributes to scientific discovery by identifying new diseases and improving understanding of known conditions. UDNI is especially valuable for low and middle-income countries because facilitate access to global specialists. Doctors in resource-limited settings can receive support for difficult cases, as well as training courses. This benefits patients while strengthening local healthcare systems over time. In conclusion, undiagnosed rare diseases highlight important gaps in healthcare systems, and the UDNI represents a promising effort to bridge these gaps.
Hello, my name is Dave Pearce, and I chair the International Rare Disease Research Consortium, or URDC. This is a global organization with representation from all corners of the world that focuses on developing research protocols and impacts for rare diseases. 3 pillars of this organization are diagnosis, treatments, and then measurable impacts and outcomes for rare diseases. Now, if we consider the general consensus is that 300 million people worldwide have a rare disease, and we go back to that first pillar of diagnosis, it's well established that it can take up to 6 years to get a diagnosis for a rare disease. So let's just consider that for a moment. If it takes 6 years, then the number of individuals with rare and undiagnosed diseases is probably twice as many, because once you do get a diagnosis of an undiagnosed disease, you fit into the rare disease category. That's part of what actually is happening and why it's so hard to diagnose. So for the past few years, on April 29th, Undiagnosed Disease Day, the Wilhelm Foundation has been sponsoring events for a call to action. This call to action is quite simple. We want to raise awareness and bring access to diagnosis to as many people who are stuck in this situation where they do not have a diagnosis for a disease. Why diagnose? Well, of course, you need to know what the basis of a disorder is, but also it provides you hope, and you can provide treatments and care because you have the knowledge of what's actually causing this particular type of disease. We have a long way to go. ICD-10-11 is the international coding for diseases, and currently there are 55,000 codes for diseases. When we consider that there probably really is only maybe 18,000 genetically confirmed diseases. So we have to sort of interact and merge these things. So this year in Gdansk, Undiagnosed Disease Day is focusing on phenotyping. Phenotyping is can we see the commonalities in individuals that have these undiagnosed and ultimately rare diseases and find a common path so we can actually get to a diagnosis more quickly. If we have too many codes, there's too many unanswered questions. So bringing everybody together so we can see those commonalities may bring us to a diagnosis more clearly. And because it's an international call to action, people around the world will have access to this type of program, and hopefully we will reduce that number of individuals with an undiagnosed rare disease, and ultimately the number of individuals that are stuck in this situation. Thank you.
Hi, my name is Marissa Ellingson. I'm a genetic counselor and I work for Mayo Clinic Laboratories. I work in one of our laboratories that performs exome and genome sequencing, which are tests that analyze essentially all of your genes for suspected underlying genetic conditions. These tests are often used for individuals living with undiagnosed conditions, and many times individuals have had prior testing, sometimes years and years of different tests that have been uninformative and have been on a diagnostic odyssey. By performing exome and genome sequencing, we hope to find the specific genetic cause for an individual's health problems. And by doing that, we hope to help find a treatment or other medical management strategies that can help individuals as well as their families.
So one thing that is new for this year's Undiagnosed Day is that we have it together with Ardera in Poland, in Gdansk, and we're very proud that we also have, as a new tradition takes it, a phenotyping meeting.
And we're doing it together with Ardera and Gdansk Medical University.
Hi everyone, my name is Mary J. Dykeman, and I'm a lawyer in Toronto, Canada. I work at a law firm called Inc. Law, and I focus mainly on health and data law, including privacy. I also have the good fortune of being an advisor to the Wilhelm Foundation. And many of you will know the Wilhelm Foundation is doing incredible work, including with the Undiagnosed hackathon. This is such great work. It brings people together from all over the world, including participants in research relating to undiagnosed disease. That includes their families, who are also greatly impacted by the lack of a diagnosis. On this coming day, April 29th, 2026, we'll all be pausing to reflect on how far we've come and how much there is left to do. It's amazing to see groups coming together in this manner. The collaboration, the creativity, the community. It's so important that people put their heads together to find these diagnoses. This is an incredible opportunity for families and for participants and people living in the system to have this opportunity to have a second look. So for all of you, the work is not all about April 29th, but it is a moment to give pause, to give thanks, and to think of all of the work ahead.
Hello, my name is Dr. Salman Kirmani. I am a medical geneticist and I work at the Aga Khan University Hospital here in Karachi, Pakistan. I am blessed to have the privilege to work with people living with rare and undiagnosed diseases. Being a geneticist and the fact that most rare and undiagnosed diseases have a genetic origin, I get to see patients and families who come after a long journey trying to understand better what is going on with their disease, with their health, and how they can get their loved ones to feel better. Through a genetic diagnosis, we try to find better, not only better understanding, but a better management strategy and better cures for individuals living with rare and undiagnosed diseases. Unfortunately, the number of people involved in taking care of such persons is still very few in the world, and so a large part of my time and effort goes in training young doctors, nurses, genetic counselors, and other healthcare professionals who can make the journey of persons living with rare and undiagnosed diseases better. The fact that these trainees can then have an impact not only within their own circle of influence, but can be on international forums and have an impact beyond boundaries is one thing that I have seen with my own eyes and have actually benefited from myself as well. Being part of the Undiagnosed Disease Network International, for example, has been a fantastic boost for patients living with rare and undiagnosed diseases in Pakistan. Through the help we have received from organizations such as the UDNI, I have been able to train more people, understand what life is like better for persons living with rare and undiagnosed diseases, and to obviously serve this community better. So I hope that these efforts continue and that the world comes closer and closer and makes all the efforts necessary so that no family anywhere in the world is left undiagnosed or unhelped. So please join this mission with us and support persons living with rare and undiagnosed diseases. Thank you so much.
Hello, my name is Tiket Kamalate, and I'm a clinical geneticist from Georgia. Today is the day of undiagnosed diseases. And on this day, I want to commemorate and cite my all-time favorite scientist, Marie Curie, who once said, "Nothing in life has to be fair. It only has to be understood. Today is the time to understand, so that we fear less." Yes, with joint efforts of global community of doctors, scientists, researchers, parents, and patients themselves, we make every effort to diagnose people living with undiagnosed diseases, to end their diagnostic odyssey, and to help and support them. Diagnosis is the light in the darkness. Diagnosis is the path for your future. Diagnosis changes everything. Happy Undiagnosed Disease Day.
Hi, I'm Luca Foschini, president of Sage Bionetworks, a nonprofit research institution based in Seattle. My brother Guido lived with a progressive neurological condition his whole life, 37 years without a diagnosis, until last year. It turned out to be a deletion involving the SHANK3 gene, Phelan-McDermid syndrome. There is no cure, but the diagnosis still changed things for our family. It gave us a name, a mechanism, and most importantly, a community. It helped us understand parts of Guido's lives that had always felt disconnected.
And I'm Robert Alloway, a scientist at Sage Bionetworks. I lead a team building open data platforms for rare disease research, and I've participated in the Undiagnosed hackathon, where scientists, clinicians, tool builders, and families come together to work on real undiagnosed cases. What makes those events powerful is not just the technology, but it's the collaboration. Amazing things happen when many different kinds of expertise are brought to bear on one person's story.
One thing I realized is that I'm not sure I would have kept looking for Guido's diagnosis if I hadn't been surrounded by rare disease work at Sage. It wasn't one specific conversation. It was being around people who don't treat undiagnosed as the end of the road. That changed the questions I was asking.
And that's why open data and open platforms matter. In rare and undiagnosed disease, no single lab or medical center has the full picture. The signal can be too rare, too complex, or hidden in data that needs to be looked at in a different way. But when families, clinicians, researchers, and data scientists are connected, some patterns can emerge. Sometimes the missing piece is not a new test. Sometimes it's just the right community of people looking together.
There are 350 million people worldwide still living without a diagnosis. We should not pretend the system is easy to navigate, or that every family has the same access to sequencing experts or analysis tools. They don't. But the resources are getting better. Getting connected to an expert that can find a diagnosis has never been easier. Initiatives like the Undiagnosed hackathons are changing how we make that match from people with a question to experts who can find an answer.
So if you're a researcher, clinician, or data scientist, I encourage you to get involved. Join a hackathon, share your expertise, make your data and tools usable by others.
And if you are a family still searching, you are not alone. Keep your records, find your community, and keep asking new questions as the science improves and testing gets more accessible. Guido's diagnosis came after 37 years. Our hope is that the next family's answer comes much sooner.
Hello everyone, happy Undiagnosed Disease Day 2026. My name is Paul Marcogliese, and I'm an assistant professor in the Department of Biochemistry and Medical Genetics at the University of Manitoba in Winnipeg, Canada. What do I do for people living with undiagnosed diseases? Well, I run a research lab where we primarily use Drosophila, or fruit flies. You can actually see some art of a fruit fly brain behind me. And we use these animals as a living test tube to assess, does an individual's DNA change, their variant, actually impact protein function? And how does this help diagnosis? Well, this helps in two ways. Number one, it can help us uncover genes that haven't been connected to disease before. Many rare disorders are caused by genes we haven't observed connected to disease before. And by showing in an animal model that a patient's variant is disrupting function can lend a lot of support to now this is a clinically relevant gene. The second thing that we do is there's a lot of individuals living with undiagnosed diseases that have genetics reports where they have a variant of uncertain significance. And there's not much you can do at this point from a diagnostics point of view. We take those variants and we use our fly models to express the variants and compare them to the reference. And if it's disruptive, that can lend support to reclassifying that variant and push it to potentially a pathogenic variant. And so that's what we primarily do. And the organizations that I've worked with over the past few years, the first was the Undiagnosed Disease Network, where I received my training. And more recently, in the past few years, I've been connected to rare disease groups that are focused on specific genes connected to rare neurodevelopmental disorders. So I'm working with those groups not only to improve diagnosis, but also use these models to take the next step and understand the disease, the mechanisms, and screen drugs. But lastly, I've been heavily involved with the Wilhelm Foundation's Undiagnosed hackathons the past few years, and plan to for the years to come. Those hackathons are, 2 to 3 day events where we take a lot of experts and use some of the expertise that I have to contribute to help diagnose individuals living with undiagnosed diseases.
Hello, I am Eric Klee from the Mayo Clinic in Rochester, Minnesota in the United States. And I've had the privilege of being involved in the Undiagnosed Hackathon in 2024 in the Netherlands, hosting the hackathon at the Mayo Clinic in 2025, and being involved with the hackathon in India in 2026. In addition to that, I'm involved with the Undiagnosed Disease Network International. At the Mayo Clinic, I lead a research team that looks for answers for people living with undiagnosed diseases. We're constantly innovating in the space of informatics and AI, and working through functional studies and other methods to find answers, disseminate those, and really help this community worldwide. I really hope everyone has a wonderful Undiagnosed Disease Day, and that we can all continue to come together to find bright futures and answers for people living with undiagnosed diseases. Thank you.
Hello friends, this is Dr. Ashwin Dalal from the Center for DNA Fingerprinting and Diagnostics in Hyderabad, India. Of the 350 million people living with undiagnosed diseases, India is home to almost 70 million of them. We have been working with people living with undiagnosed diseases for last 20 years. We have been doing diagnosis as well as counseling them about possible treatment, as well as options for prenatal diagnosis, so that a second child is not born with the same disease in the family. Recently, we had a very nice experience of organizing the first ever undiagnosed hackathon in India as part of collaboration with the Wilhelm Foundation. Almost 25 families registered for this and sent their patients for participating in this hackathon. And of these, 18 of them attended the hackathon along with more than 100 experts from India as well as abroad. It was very nice to see so many people working together to find diagnosis, and by the end of 2 days, we had obtained diagnosis for 7 out of 25 families. It was so nice to see the smiles on the faces of the families who had been able to find a diagnosis after a long diagnostic odyssey. We hope to conduct more such hackathons in India in the coming years, and hope to continue working with people living with undiagnosed diseases so that we can try to help such families to obtain diagnosis and further counseling.
Hello all, I am Dr. Usha Datta. I am working as a geneticist in Center for DNA Fingerprinting and Diagnostics, CDFD, Hyderabad, India. And my main research area is I work on breakpoint mapping of structural variants by long-read sequencing in genetic disease project. So I came to know about Wilhelm Foundation chairman, especially Helen Sideroth and Mick Sideroth, in November 2025, as we were organizing hackathon, fourth hackathon, along with Wilhelm Foundation on February 3rd and 4th. So amazing, like she's a philanthropist and a very charming lady. It was an honor to really meet her when she has come for hackathon here. Because I have seen lot of people, but then she really inspired me so much. And we, in this hackathon, we have recruited around 25 undiagnosed people. And then there were a lot of clinicians, bioinformaticians, scientists from all over the globe who has come here, and then we were working on these 25 cases. And we were really able to diagnose 7 cases here. And every time there was a case which was diagnosed, Helen has come and she was ringing a bell, and whenever there is a bell which is ringing around, all the people were, standing up and they were clapping. That means there is a sort of happiness that an undiagnosed child is diagnosed with some particular disease. So it was such an inspiring thing, it was with, there are a lot of workshops which we have organized, but this was something like, it really touched my heart. She's a lady with a mission, so let's join Helen and help diagnose the undiagnosed. Hope many of us get inspired by her and emulate Helen. Thank you.
Dear Mick, dear Helene, we had a wonderful national undiagnosed hackathon here in Nijmegen today. And it's not just me, but it's this entire room full of Dutch human geneticists. And with 160 people, in 48 hours, we made 5 new diagnoses out of 33 cases in the Netherlands. So once more, applause and best regards to Sweden for Undiagnosed Day 226. Applause!
Hi everyone, my name is Rajiv and I am a researcher from India. I'm currently working at Fujitsu Research. Rare diseases and undiagnosed diseases are subjects that are very close to my heart. As a computational researcher, I'm very passionate about deploying modern computation technologies for accelerating research on rare and undiagnosed conditions. We are in the age of AI, which is a truly disrupting technology, but it also presents huge opportunities, particularly for rare disease research. It enables us to consolidate knowledge that has been historically siloed across various geographies, particularly in a developing country such as India that is resource constrained and has limited state capacity. This is very important. Many of the times, the problems that patients with rare and undiagnosed conditions face is not just scientific or the lack of research, but also social and structural. It's not uncommon knowledge that there is a resource gap in the medical community when it comes to identifying or diagnosing the conditions properly. Therefore, a patient might get misdiagnosed or even remain undiagnosed, where in fact a diagnosis might be possible. And I'm very lucky to be working with the Wilhelm Foundation, and some very passionate and wonderful mentors as partners to lead these AI tools and frameworks that can enable us to make a knowledge ecosystem for rare disease research, and helping us to accelerate finding a diagnosis for people who still are undiagnosed. Apart from scientific research, I'm also passionate about building community bringing together people from various domains and trying to bring the focus on their disease research. As I said, there is a gap in the medical community, and I've been trying to educate institutions and medical researchers about the modern advancements that are happening elsewhere around the world. And I think it's super important that as researchers, we play our part as well in building community and awareness in the scientific community. Finally, about from scientific research, it goes on, it takes its own time. A patient would be waiting for getting a diagnosis. Once they have a diagnosis, they'll be waiting for science to catch up for therapy to come, right? But I think meanwhile we do all this science, it's also important that we have a more inclusive society, a society where people with undiagnosed conditions, with their diseases leading to progressive disabilities, have a fair chance to participate in society and also to contribute to society, making it a better society. Therefore, apart from my scientific research, I'm also involved in advocacy initiatives with NGOs here in India. Recently, I did an internship with the Wilhelm Foundation on progressive disabilities. And of course, I also participate in various events and academic engagements, such as the recent Undiagnosed hackathon here in India, and hope to continue to contribute to the science and various engagements around their diseases and undiagnosed conditions. Thank you so much.
Hello, my name is Gida Landure. I am at the University of Science, Techniques and Technology of Bamako in Mali. For more than 15 years now, I work on rare diseases, specifically those with neurological conditions. But in recent years, we have extended our collaboration with other departments like the cardiology, the pediatrics, and other subspecialties, because we are the only team working on medical genetics in the country. For this time, we have collected more than 1,000 families with several phenotypes, including neurology and other subspecialties. And we have come to a diagnosis for more than 300 of them, and we have found novel genes, we have found variants in known genes. It's true that we do not have medication for most of them, but we think that making the diagnosis can at least mitigate the stigma they are going through, like bad fate or other mystical causes. And knowing our diagnosis and ending the diagnosis odyssey is meaningful because it helps stop medical spendings, and also knowing the diagnosis can help them set for clinical trials and benefit sometimes a medication. So we have organized our patients in a patient group now. They have their own association, and through that association we organize every year the Rare Disease Day in February. And increasingly this association have helped to advocate the rare disease case with our political leaders and other donors. So I take this time for the Undiagnosed Disease Day to thank all the people working on rare diseases, and also extend my greetings to the patients and their families, and call them for more actions, call them for more gathering, because scientists cannot do anything without the patients. And with the accompaniment of our governments and philanthropists, I'm sure that in the coming years we can overcome the treatment access issue. So happy Rare Disease Day, and we hope that in the coming years we will have treatment for all of them. Thank you.
Good day. My name is Dr. Eva Maria Cutionco de la Paz, and I come from the Philippines. I am part of a community of clinicians, researchers, and advocates working at the intersection of genomics, public health, and patient-centered care. Our work with patients encompasses building a pathway that makes diagnosis and treatment more accessible for people who have been living with an undiagnosed disease for far too long. To the more than 350 million people worldwide living with an undiagnosed disease, and to your families, please know that we are trying our very best to change that narrative. We are building networks that connect patients to specialists, integrating genomic technologies into clinical care, and working with governments and partners to make all these tools more accessible and affordable. We are also strengthening our collaborations both locally and globally. But beyond the use of all the best that modern science offers, what truly matters is our partnership with you. Your lived experiences guide us. Your stories push us to do better. And our great motivation is to make sure that every healthcare system includes you. We are committed to walk this journey with you. We believe that every person deserves a diagnosis, deserves access to care, and deserves the right to be seen and heard. And we will keep working together until we are able to deliver the promise of a better future for all of you.
Good morning. My name is Manuel Posada. I am a full research professor on public health and also on internal medicine. And my work has been devoted for many, many years to the rare disease at the European level and also international organizations such as the Undiagnosed Network International. I was the director of the Rare Disease Research Institute in Madrid, in Spain. And during that time, I created the UDP program and diagnosis program, called it Spain UDP, in collaboration with the international network. And also, I provided diagnosis of many, many patients during these years. After my retirement of this governmental institution, I'm currently working, coordinating and leading Latin America network calling RIVERSER, Spanish acronyms, which is mean the Ibero-America Research Network on health research on rare diseases. And during this period, these 2 years, when the RIVERSER has been carried out many types of work, one of the work has been the training in genetic in order to provide more capacities to the professionals in Latin America, across Latin America, every country, in order to provide, they can provide their diagnosis to the patient and diagnosis of which complex diseases, rare diseases. And now we are organizing a hackathon, diagnosis hackathon, with the National Institute of Genomic Medicine in Mexico, one of the partners of the RIVERSER. And also we are going to analyze and to try to make the diagnosis to 10 patients for many, many countries on Chile, Argentina, Paraguay, Uruguay, and Mexico, of course. This is the idea of our network, to collaborate for the 2 future years in order to organize more capacities among the professionals in order to continue the provision of the diagnosis to this kind of patients. In this Undiagnosed Day celebration, I would like to thank to people leading the Wilhelm Foundation over the Undiagnosed Network International, because the work and the involvement in this kind of strategies has provided many of us different skills that can have been valid for other kind of countries and other kind of situation. Thank you and good day.
Greetings to all conference participants. My name is Oleg Plevidze. I represent the Georgian Foundation for Genetic and Rare Diseases. I am very sorry that I cannot participate in the meeting in Gdańsk in person. I am proud that along with other representatives of our country, I am a member of such a wonderful and advanced organization as the Undiagnosed Disease Network International. Participating in its activities in various committees is a great honor and benefit for us and for all patients with rare and undiagnosed diseases. For our part, we will do everything possible to ensure the speedy implementation of the undiagnosed disease program in our country in one format or other. Here I would like to take the opportunity to convey my best wishes to the conference organizers, the Wilhelm Foundation, dear Helen and Nick, the entire Erdera team, and especially to the host, Professor Yolanda Verzba, with whom we have many years of close friendship and cooperation.
My name is Roberto Giuliani, a medical geneticist from Brazil, working for over 40 years to speed up the diagnostic journey of persons living with undiagnosed disease. I am a member of the Undiagnosed Disease Network International, and 3 years ago we inaugurated the Casa dos Raros, a center exclusively dedicated to care, diagnosis, research and training in rare disease, located in Porto Alegre in the south of Brazil. This non-profit philanthropic institution implemented several initiatives, including the first Brazilian program on undiagnosed disease, a partnership between Casa dos Raros and Dasa Genomics. Although this program was able to reach a diagnosis in 20 out of the first 40 undiagnosed cases evaluated, we realized that we should go further and created Rebrand, the Brazilian network of undiagnosed disease, to incorporate more sophisticated analytical methods and a multi-omics approach to the diagnosis of rare disease, in a partnership of Casa dos Raros with Brazilian and international centers. To further stimulate the work with undiagnosed disease in the Latin American continent, we organized in October 2025 the 14th UDNI conference in Rio de Janeiro, with hundreds of participants from 45 different countries, all continents represented. In the Undiagnosed Day, we highlight the importance of partnership and international collaboration to improve the lives of persons living with undiagnosed disease.
Dear friends and families, it's really an honor to join you today for this Global Undiagnosed Day. We at Rare Disease International, we are truly grateful for the opportunity to contribute to this important moment of reflection, awareness, and action. And thank you, Helen and Nick, for the invitation. We know that Undiagnosed Day is not only about the people living with the absence of a diagnosis, it's about those families still living without answers. People, families who are still searching, still navigating healthcare systems that are not designed for them. And it's about the urgent need to build pathways, not only for diagnosis, but also to care, for support, for recognition, even when answers are not there yet. We know how powerful a diagnosis can be. It gives you a name for a condition, to be recognized, to be visible. It changes everything because it gives people and families the dignity and the support they deserve. However, for many families, the journey begins long before any medical label is given. It begins with questions, with doubt, with the feeling that something is not quite right, but without the tools, the recognition, or the system to respond. And what we often hear from families across the world is this: even without a diagnosis, the needs are real. The need for coordinated care, for guidance, the need to be heard, believed, supported. And yet, too often, healthcare systems are built around diagnoses, not around people and families. So this is where the concept of care pathways becomes so important, and also where collaboration plays a key role. At RDI, together with Wilhelm Foundation and the Rare Care Center from Perth, Australia, we have been working closely during the past 9 months to rethink how care can be better organized for people living with rare and undiagnosed conditions. So as part of this huge work, we brought together a large and diverse working group. People from different backgrounds, different countries, different regions, almost 55 people in total, including clinicians, nurses, experts, policymakers, advocates, and most importantly, and people. And I have to say that it has been an incredible, enriching experience because we did not start from theory. We started from the lived experience. We spoke to families of children living with an undiagnosed condition. We listened to their stories. We worked with them to understand their needs. And with these interviews, but also together with our working group members, we were able to validate what were the key pain points along their journey, the moments of uncertainty, fragmentation, lack of support, and we started to build a pathway exactly from there. So together we work to develop this framework that brings together all the essential elements of care, something that can be adapted to different conditions and tailored to different contexts. But what was most striking and what emerged clearly during the conversation and the discussions with the working group members was this: that care should not begin at diagnosis. Care should be there throughout the entire journey, long before a diagnosis is reached. And care should not be understood only as clinical care. It must include support for the whole person and for the whole family. So we're talking about psychological support, guidance, information, educational support, support during fragile moments or key transitions, and continuous coordination across services and care. So in other words, care must accompany the people and the families across the entire journey, not just during specific medical moments. So as we mark this Undiagnosed Day, we are also at a moment of opportunity. There is a growing recognition globally of the need to address rare diseases, not diagnosis, but through stronger healthcare systems. And the momentum around the World Health Assembly resolution on rare diseases that was adopted last year in May reflects truly this shift. There is a growing commitment globally to ensure that people living with rare and undiagnosed conditions are no longer invisible within the health systems. And this is where we all have a role to play, from healthcare professionals to researchers, policymakers, private sector, patient organizations, and of course families. So today I'd like to close with this reflection that a diagnosis can change a life, but even in the absence of a diagnosis, care, dignity, and support should never be on hold. So let's continue working together to ensure that no family feels invisible, that no journey is faced alone, and that every person, diagnosed or not, have access to the care they need and deserve. So thank you for your commitment, for your advocacy and your partnership. And I wish you a very meaningful and impactful Undiagnosed Day.
Hi everyone, I'm Dr. Yasemin Alanay. I'm a pediatric geneticist from Istanbul, Turkey, and I'm the director of Acıbadem University's Rare Disease Center in Istanbul, Turkey. And this is my team, and this is our Undiagnosed Disease Program Zoom meeting, weekly Zoom meeting where we discuss individuals with undiagnosed conditions. We just finished discussing 4 individuals' cases, and I'd like to introduce my team. We are 3 clinicians, Özlem, Esra, and we have a clinical coordinator, Şebnem. We have a data analyst, Gizem. We have a computational biologist, Özkan. We have a research coordinator, Alper. And we have a biobank technician, Hüma. And we also have a MD, which is doing research with us. And we have a bioinformatician, Tuğçe, along with us. So it's a huge multidisciplinary team. And we hope we can help more children and adults this year. Thank you.
Hi everyone, I'm Yarik, Dr. Yaroslav Kinev. I'm a research fellow at King's College London, United Kingdom at the moment, and right now I'm at the campus and the weather is fantastic. As you probably all know, the current diagnostic rate for rare people affected by rare diseases is extremely suboptimal. So for some conditions can be less than 25%. And which means that despite we can sequence our genome sufficiently, we cannot interpret them. And I'm working on different ways how we can improve the interpretation of coded and uncoded variants in human genome, which hopefully will help to get more and more diagnoses in the future. Thank you very much. Have a nice day.
Hello everyone, my name is Sofia Duzuhauge. I'm a clinical geneticist and I'm very glad to be here today with Ingeborg Johannessen and Victoria De Lange, who both just got on the research track for medical students of the University of Bergen to be part of our research looking into finding answers for the genetically undiagnosed here in Norway. And I think this is obviously a very interesting and exciting field, but I also think it is very challenging. So my question to you is, what draws a younger colleague in this field of research? Ingeborg.
The first thing is that the field has huge knowledge gaps, so there's still so much we don't know. And so many new technologies to learn, so that's really intriguing me. But also to be able to do work that has real impact on both individuals and public health. So, yeah.
So something really worth your time.
Yeah.
Yeah?
Yeah.
And Victoria?
For my part, I've always loved puzzles, and I think this is a field where we have a lot of data, but it's incomplete and a bit scattered. And it's a great opportunity to be able to identify the pieces and be able to put them in the right place.
Yeah, so I mean, solving the unsolved is exactly doing that. Yeah. So on our behalf from Bergen in Norway, happy Undiagnosed Day. And here is to many more diagnoses for everyone.
Bye.
So we want to thank all our speakers that you've seen today, and we want to especially thank the ones that are contributing to helping these 350 million people living with an undiagnosed disease in the world. And we want to, again, help everybody understand that we can only solve 40% today. We still have 60% that needs our help. And thank you all for chipping in.
Thank you.